From the JAMA Network, this is JAMA Ophthalmology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Ophthalmology.
Hello, and welcome to our listeners around the world. You're listening to JAMA Ophthalmology Author Interviews, and thanks for joining us. I'm Neil Bressler, Editor-in-Chief of JAMA Ophthalmology. Today, we're going to look at an original investigation on ophthalmic complications associated with the antidiabetic drugs Semaglutide and Tirzepatide. And joining us is the first author for this report, Dr. Bradley Katz. Dr. Katz is a professor in the Department of Ophthalmology at the John A. Moran Eye Center at the University of Utah Health in Salt Lake City, Utah. Brad, thank you so much for joining us.
It's a pleasure.
Maybe we could just start with these ophthalmic complications. Before we get into any of the associations that you looked at, the ophthalmic complications that you looked at, I think mainly were focusing on non-arteritic anterior ischemic optic neuropathy. Not a mouthful for a neuro-ophthalmologist like yourself, but maybe you could just define that entity for us before we get into your associations.
Sure. So when I'm talking to a patient in clinic, I will often describe non-arteritic anterior ischemic optic neuropathy, or NAION, as an optic nerve stroke. It typically occurs in patients later in life, like in their 50s and 60s, but it can occur earlier in life. It's associated with nocturnal hypotension and the usual vascular risk factors like high blood pressure, high cholesterol, diabetes, and smoking. And it usually just occurs in one eye. It's usually noticed on awakening, and it's usually painless. On examination, patients have optic nerve swelling at presentation that resolves after about 6 weeks. And it can range from mild to severe, with most patients losing about half of their peripheral vision in a typical situation.
And do you know why some people might develop this in relationship to the size of the room that we have for our optic nerve? I've often heard people tell us if you have swelling in one eye and you look in the other eye and the cup to disc ratio is 0, maybe it's 0 because there's barely enough room for all those nerve fibers going through there. Can you explain that a little bit more?
Some people believe that ischemic optic neuropathy is like a compartment syndrome. So you get swelling of the optic nerve, which then compromises the blood flow to the optic nerve. And you're absolutely right. It almost exclusively occurs in patients with a small cup to disc ratio, either no cup at all or maybe as much as a 0.2 cup to disc. But that's also a recognized anatomic risk factor. And again, it's thought to be because of crowding of the optic nerve.
Okay, so let's get into your investigation with your colleagues. You pointed out in your introduction that these glucagon-like peptide-1 receptor agonists like semaglutide are being used increasingly for glycemic control in diabetic patients or even to induce weight loss in people with or without diabetes. And there was an article this past summer in JAMA Ophthalmology in 2024 reporting a retrospective matched cohort study, and that group found an increased risk of non-arteritic anterior ischemic optic neuropathy associated with semaglutide. So were those findings related to your team initiating this investigation, or is this something that came up coincidentally, entirely independent?
This did come up coincidentally. So about a year ago, I personally saw a patient who had sudden painless vision loss after using semaglutide. And at that time, that article had not come out yet. And after the dust settled, her internist wanted to put her back on semaglutide because her glycemic control was poor. And when she restarted it, she had ischemic optic neuropathy in her other eye. And that prompted me to reach out to my neuro-ophthalmic colleagues. We have a listserv through the North American Neuro-Ophthalmology Society that we use. And I just said, hey, I saw this weird thing in the context of recent starting of semaglutide. Has anybody else seen that? And that led me to collecting these 8 other cases, 6 cases of ischemic optic neuropathy, 1 case of papillitis, just swelling of the optic nerve without a loss of vision. And then 1 case was reported to me of paracentral acute middle maculopathy. all in the context of use of either semaglutide or the related drug tirzepatide.
So let's just concentrate on those 6 cases where your colleagues, other neuro-ophthalmologists said this is non-arteritic angioischemic optic neuropathy. You mentioned that your case was perhaps soon after starting semaglutide. How soon after in your case? And did you collect similar information from these other 6 cases? How soon after had they taken that and then they saw this non-arteritic angioischemic optic neuropathy?
My patient experienced vision loss the next day, so it was just one day after starting the drug. And then the other cases that I collected were anywhere from 3 months to 16 months on treatment before ischemic optic neuropathy manifested.
And were these in one eye and then the other eye, or were the other cases just in one eye? Do you recall?
Yeah, so in my patient, it was sequential, first one eye and then the other. In 2 of the other cases that were referred to me, there was, even though the optic neuropathy was only in one eye, they presented with bilateral disc swelling, which is very atypical for ischemic optic neuropathy. And then the other 4 cases presented with typical unilateral swelling.
Now, of course, with these surveys, so to speak, that you might send out, you never know if your denominator, that is the number of neuro-ophthalmologists responding, is everyone or some of them. About how many people are in this group, and did the people who didn't see such a case, did they tell you, oh, thanks for writing to me, I don't have any cases that I've seen so far? What's the denominator here in terms of the total number you reached out to, approximately? And then did everybody answer? Did some of them answer? Did only the people who saw a case answer?
So there are just over 800 people on this listserv that I mentioned that we kind of share interesting cases with. So I got a response from 4 people who said that they had seen some ocular thing in their clinic in a patient that was on one of these drugs. But I didn't get any responses from people saying, gee, that's interesting. I've not seen anything like that. So you're absolutely right. It's not done in a scientific prospective manner. And I don't know what the denominator is.
Certainly it's prospective and you're reaching out to them, and it's retrospective in people's recall. Maybe some people didn't bother to answer. Maybe some people got the diagnosis wrong and they were just telling you what they remembered. But certainly you had several people that noted this. Has this come up before? Has there been anything on non-arteritic angioischemic optic neuropathy prior to your survey with the neuro-ophthalmologist? Had they brought this up previously, or nothing prior to, let's say, the investigation from the group in Boston that reported their matched cohort study?
After I sent out my query to the Nanos listserv, then one of the cases that's collected in this series was presented at our annual meeting. I believe it was in March of this year. And then just a few months later, the article came out from Mass Eye and Ear showing this increased prevalence of non-arteritic anterior ischemic optic neuropathy in patients taking semaglutide. So that kind of put a fire underneath me when I saw that article, and I said, hey, there's something real going on here, and we need to get this information out there to other ophthalmologists as soon as possible.
And going to some of the mechanisms or the swelling that was reported in your group, at least the ones that were reported as non-arteritic angioischemic optic neuropathy, did you get images of these? Do you have images of the fellow eye? Did the fellow eye have a 0 cup to disc ratio or pallor or something else? I know you told me your case developed in one, then the other. What was going on in the other eye with these people?
So in all the cases that I collected, including my case, everyone had a small cup to disc ratio, either 0.1, 0.2. The largest one was 0.3. And those were just reported to me by the investigators. I didn't require them to submit pictures to me for my review.
And interestingly, in your report, and I hope our listeners will take a look at this in detail, given the ubiquitous almost use of these agents right now, you mentioned that maybe these were related to some sort of rapid control that was brought on by adding this medication, or maybe somehow the course of the diabetes had changed in some way at the time that this medication was being added, Can you talk a little more about that? What made you hypothesize that that may be related to the association that you saw?
So I think everyone's familiar, most ophthalmologists anyway, are going to be familiar with the fact that if you have a patient who has poor glycemic control and then they suddenly get under good glycemic control, that can cause or exacerbate diabetic retinopathy. And that was shown to be true with this class of drugs. So in the SUSTAIN 6 trial, where cardiovascular outcomes were being investigated in relation to use of semaglutide, it was reported that patients with pre-existing diabetic retinopathy noticed that their retinopathy got worse in the group that was randomized to semaglutide, as opposed to the other group that was randomized to anti-diabetic drugs not in this class.
You also mentioned that perhaps this is not proof of a cause and effect relationship. Can you give us some other hypotheses as to why this association might have been seen? Could it just be coincidental that some patients are going to get anti-ischemic optic neuropathy and many patients have been starting semaglutide? What are you thinking about in terms of the association and maybe confounding factors that could have led to this?
It's also known that in addition to exacerbating pre-existing retinopathy or even pushing somebody from non-proliferative to proliferative retinopathy or inducing diabetic macular edema, patients whose glycemic control is suddenly being brought under better control can also develop papillitis, which is a swelling of the optic nerve, usually asymptomatic, without any vision loss. Our hypothesis is that some of these patients who are put on these very effective drugs notice a rapid decline in their glucose or blood sugar. That induces papillitis or swelling of the optic nerve. And if you happen to be an unlucky person with a crowded optic nerve with a small cup to disc ratio, maybe that swelling of the optic nerve reduces blood flow to the optic nerve and induces an optic nerve stroke, an ischemic event.
So some of these hypotheses revolve around this rapid control or rapid change in the control of the diabetes, perhaps coupled with a predisposition to this small cup to disc ratio that may add to that. And again, so many people taking this that you might identify a few people wherein this happens. Is that correct?
That's absolutely correct.
So what are the next steps? We realize the limitations. This is an association that was seen. It could be due to other things. This was a survey. We don't know exactly what the prevalence of this would be or the incidence either. That's not what your study was designed for. It was just recognizing this phenomena. What are you or your colleagues thinking about in terms of investigating this further?
The American Academy of Ophthalmology published a press release shortly after the JAMA ophthalmology report last summer showing this increased incidence of ischemic optic neuropathy, because that spooked a lot of patients and it spooked a lot of doctors. And I think the recommendation from their standpoint, from the Academy's standpoint, is that we need to look into this further. We need to know what the denominator is. And so they have recommended a post-marketing study be done, a surveillance actually for ischemic optic neuropathy to determine how prevalent is this. But in the meantime, because the best thing we have to go on is this hypothesis that it's inducing glycemic control that might be contributing to ischemic optic neuropathy, the recommendation in our manuscript is just that you shouldn't not take these drugs. They're very effective, but we would recommend that physicians prescribing these drugs just take some extra care to go on to them slowly and try to drop your blood sugar in your patients more slowly. And that might reduce the incidence of this ocular complication.
Presumably, many of these patients already are seeing someone looking at their retina and optic nerve, or they should be doing that. So maybe this gives us just another reason to watch for the more common diabetic retinopathy that these patients need to be monitored for.
Yeah, it's so important. I mean, diabetic retinopathy is still a substantial problem in terms of vision loss throughout the world. Just getting your diabetic patients in for at least a baseline exam, I just can't emphasize enough how important that is.
And finally, with your survey, do you have an idea of how these patients are doing? Are they getting complete recovery? Are they seeing some red desaturation with resolution of the swelling that occurred? How are they doing? And Did you get any feedback on people who don't have diabetes and whether they're seeing this in people taking semaglutide as well?
6 out of the 7 patients that we reported were diabetic. One patient in their 50s did experience ischemic optic neuropathy while on one of these drugs for weight loss. My patient is doing actually pretty poorly. Like, she's really functionally blind, had to quit her job, can't drive anymore. It's been devastating. The other patients all have retained good vision in their fellow eye, to the best of my knowledge, so are still able to do most activities of daily living, but none of them experienced any visual recovery.
That's really helpful, and we're so appreciative that you did this survey, that you got this information from your colleagues in neuro-ophthalmology and shared it with us in this investigation. Thank you so much for doing this.
It was my pleasure, Neil. I think it was a nice compliment to the article that was published earlier in the summer to kind of give physicians and patients just a little bit broader picture of what's happening with these drugs because they are being prescribed so much throughout the country and the world. Thank you.
Absolutely. And all your cautionary statements regarding lack of cause and effect and the very few cases relative to the very good control these agents can do, I think were all appropriate. Thank you once again, Brad.
Pleasure. Bye-bye.
I'm Neil Bressler, and I've been speaking with Dr. Bradley Katz about an investigation on ophthalmic complications associated with the antidiabetic drugs semaglutide and tirzepatide, specifically non-arteritic angioischemic optic neuropathy. You can find a link to this article in this episode's description. This episode was produced by Shelley Steffens at the JAMA Network, and to follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.